And welcome back in your community headlines. Today I am joined by Dr. Arturo Torices. Talk to me a little bit about, well, a man's weight loss journey. You know, sometimes we tend to see moms, aunts, sisters. I feel like they take care a little bit more of their, more of their health per se, a little bit more. I know my mom's always pushing my dad around. You need to go to the doctor, get your checkups in. But let's talk a little bit about how surgery plays a factor as far as a healthy lifestyle for men.
Yeah. So you're correct. So first of all, June is the Men's Health Month, right? So that's why we're gonna talk about this. And you're right. I mean, in general, men, they are less likely to seek medical attention and go to the doctor, right? Number one. And men tend to have more problems with diabetes, hypertension, and even morbid obesity, right? Being overweight. And like you're saying, I mean, bariatric surgery is a good tool, and that's something that we use nowadays, and even from long time ago. It's the best management for weight loss, long term, and it used to be known as bariatric surgery to lose weight, right? Because we used to think, oh, you're gonna look better, but now we know that it's not just looking better, but actually you're feeling better, you have more energy, and you are there for your family.
And it changes your lifestyle, right?
Correct. And now it's known more like metabolic surgery because it's not just losing weight, but also you're improving and sometimes even curing problems like diabetes, hypertension. Patients that they tend to take around 5, 6, 7 medications. After one of these surgeries, they can stop taking some of these medications or even all of them. So that's why it's important that it's a good tool to consider if you're struggling with losing weight.
Okay, and so once you have this surgery, I'm assuming you have to kind of pair up with a different lifestyle. You're not going to be able to do the same things you were doing before, right? Maybe
that's correct.
Not being in that long drive-through line, getting some fast food.
It's a big thing getting bariatric surgery. It's a life-changing procedure, right? And like you were saying, you're gonna have a lengthy relationship with your surgeon, with your family doctor. We need to make sure that you're in a good lifestyle, changing your diet, taking vitamins, and taking care of yourself. So yeah, definitely, it's a big change, but it's gonna be a good change for you.
Now let's talk about here in the Valley, right? Obviously, you know, you're over at Mission, and you see our Valley men, you know, frequently, often, and is that kind of obesity? Is that a thing that we see a lot here in the Valley? I know we're surrounded by great food, very rich in Mexican culture, and unfortunately, you know, some of that food tends to be really greasy. I mean, what does that look like here for us?
Yeah, I mean, we are located in an area where actually, statistically, we are one of the biggest concentration of morbid obesity patients and population. So you're completely right. I mean, geographically, this is an area where bariatric surgery is a good tool for people to lose weight. Like I said, I mean, you can change your diet, you can do some more exercise. All these fancy new drugs that we know, the Mounjaro, Wegovy, all these medications, those are good. But statistics have proven that bariatric surgery is the best procedure for this and helps, like I said, not just losing weight, but also helping with other medical problems.
Absolutely, and of course, like you were saying earlier, pairing that with like a good lifestyle. Exactly, and you know, it is Father's Day week.
Oh yeah,
because it's Father's Day on Sunday, so maybe, you know, if someone's looking to get a good gift for their dad, I mean, that might just be it.
Yeah, if you're interested, and you can get the information, and you're more than welcome to come talk to us, or just go talk to your specialist, talk to your family doctor, go talk to a nutritionist. But remember that you are not alone, and we are here to help you. And bariatric surgery is a great tool for this.
Well, thank you, Dr. Arturo, so much for joining us. And, you know, you heard it here first. If you're looking to get that surgery, you also have to pair it with a good lifestyle in order for it to work and stick around.
Thank you very much.